Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the host of the Dean's Chat podcast, and I'm also the dean at the Arizona College of Podiatric Medicine. My guest today, Dr. Jason Kayce, is a successful podiatric physician from Phoenix, Arizona. Dr. Kayce did his undergraduate work at the University of Maryland. He was a 2011 graduate of the Arizona College of Podiatric Medicine. He did his residency training at Cambridge Health Alliance between 2011 and 2014. Dr. Kayce is currently in private practice at the Paradise Valley Foot and Ankle Center. He's also part of our hybrid clinical faculty at the Arizona College of Podiatric Medicine, which we will discuss further. And he's been an assistant professor at the Arizona College since 2019. Dr. Kayce is faculty at the American College of Foot and Ankle Surgeons, and he's been very active for many years, and we'll talk more about that. He's also an attending with the Creighton University Podiatric Medicine and Surgery Residency Program. Welcome to Dean's Chat, Dr. Kayce.
Appreciate you having me.
Well, it's great to have you here. You know, we kind of have that Dean's Chat, fireside chat vibe, so we go by first name. So let's go with Jason and Jeff.
Love it.
Sounds good. So, Jason, to get started, to kind of set the stage, I was going to ask you about your podiatric journey from the early days.
Sure.
When did you find out about podiatric medicine, and how did you decide on the Arizona College?
So early on, basically, I just went into my undergrad years pre-med and wasn't sure what I was going to go into. Honestly, I really didn't know about podiatry as a whole, and I was always interested in sports medicine. When I was in college, I just always assumed I would try to go to orthopedic surgery was my goal. My sophomore year, I injured my ankle, and this was around the DC area, and I went and saw a podiatrist, had no idea what the field was. Started picking his brain a little bit beyond my personal injury and asked if I could shadow him here and there. So I would shadow him off and on for a couple of years. And it's a really small world. It turns out, so this doctor, it's Dr. Ross Taubman, if you're familiar with him.
I know Ross well. I was with him on a podcast last week.
It's such a small world. So I randomly injured my ankle, landed in his office, of all places. He allowed me into his office to shadow him. So after a couple of years, through his guidance, that's what sort of convinced me to apply to the podiatry schools in the country. And when I was applying, Arizona specifically interested me purely just because the DPM students are combined with the med students. And going into podiatry school, I wanted to be as even keel and on par with med students as possible. So that's what the major appeal was with Arizona.
Oh, very good. Dr. Taubman is such a passionate proponent of the podiatric profession, such a leader in our profession. When you were shadowing him, what stood out to you, not just about podiatric medicine, but what it's like to be a podiatrist?
Well, one area I found it incredible when I was shadowing him. So he actually had an OR suite within his private practice office setting. So we would see some patients, and then we might hop in for, a bunionectomy or some smaller type elective outpatient cases. So we would do a case, then we would see a few more patients, then we'd hop in, do another case. And I had never seen another field where you could have the surgical realm in addition to seeing patients. And that was just very highly appealing to me.
Well, that's interesting because I've been working with Dr. Taubman on an initiative called Feet on the Street, which is a student recruitment initiative. And we're always talking about that shadowing experience. And as small as the world is, like you said, yep. We've relied on you a lot over the years to help us with students that are interested in podiatric medicine in the Phoenix area to be the go-to mentor shadowing doctor. And we appreciate that. What do you tell those young aspiring podiatry students when they come into your office?
So I don't sugarcoat anything, and I like to tell it like it is. I don't want to, make someone's decision for them. I like to, lay everything out, the pros, the cons, and really get a feel for that individual and just let them know truly what we do day to day, year after year, and if it's the right fit for them. And, if it is, then obviously I encourage applications. And even if they're unsure, it's always okay to apply somewhere, and then you still have some time to make that decision. But, I really just kind of lay it out there and just tell them like it is.
Oh, that's great. So you came to Arizona, 4 years in Arizona, and then you headed to Boston for your residency training.
That's right.
Tell us about that a little bit.
So I was born and raised in Boston. So I'm a native of the East Coast, and I always just thought I would end up in Boston long term. And That's where my family grew up, aunts, uncles, cousins, grandparents. We were all from Boston. So did my schooling in Arizona, moved back to Boston for residency. During my time in Boston, basically everyone, extended family-wise, immediate family-wise, had left Boston. So I was the last person there. So there was no real strong tie holding me to Boston. But while I was there, and I do tell this to students quite a bit, so when you're looking at residency programs, you don't have to train where you want to live thereafter. It might be easier to find a job within that area. However, just go to wherever you're going to get the best training possible, because you can live anywhere. As long as you have your hand skills and your mindset, you can really practice this profession anywhere. So when I was in Boston, I had a couple of offers that were just, turnkey shoe-in type offers within the Boston area. And then I got a phone call from a previous resident at a program in Boston when I was a fourth-year student, is when this individual was a third-year resident. And he was living in Arizona. He had worked for a big group out here in Arizona, didn't love it, and thought about breaking off and starting his own practice. So he called me, knew I had spent some time in Arizona. We had stayed in touch, asked if I was interested, and I told him no. I just, coming out of school, having loans, it just seemed like an overwhelming task. And he, told me to take a step back, just think about everything and just let him know. So we talked later on. I flew out, spoke to him in person, kind of looked at some areas, looked at some spaces. And at the time, I didn't have, a wife and kids. So it was just me. And I figured if I was ever going to really start something, if it didn't go so well, it was just me that I was supporting. So I figured, why not? I could always maybe find a job that's a turnkey type offer somewhere else, but I won't have all that many opportunities to start a practice.
Sure.
So that's how I landed back in Arizona.
That's great. So throughout your training experience, did you have any mentors who really shaped you as a podiatric physician?
Sure. So lots of mentors along the way, and it started even in college. Specifically, though, when I was in residency, there was one of my in-house attendings, Michael Theodulu is his name, and he really kind of almost took me under his wing and, almost treated me like a son during those few years. And he really, instilled the confidence in me, and he really kind of drove home, when someone comes into your office, whatever the issue may be, like someone has to help them. And so why not you? And that really kind of stood out to me as you get into practice and there's bigger cases that roll in. And, when you're early on in your career, sometimes it can be intimidating to take on some of these larger cases, but, someone has to do it. And if you have the proper training, why not you? Why not me?
Well said. And in your residency program, who are your mentors there?
So Dr. Theodulu,
right.
Dr. Harry Schneider.
Yeah, oh, for sure.
And Adam Landsman.
Oh, fantastic. I know Adam well.
Yeah, so that was our main three in-house trio. And it was awesome because all three trained in different locations of the country, different eras. So it was kind of nice where we had this blend of different, teaching philosophies. A lot of programs, well, not a lot, some programs, it seems like all the attendings trained at that program, which can be great. But on the flip side, if you're a resident at those programs, you're going to get trained similarly from each attending. What was nice about this training was it was such an eclectic mix between the three of them. Also where I trained, so in Massachusetts, DPMs can't do ankles, basically. You can do ankle scopes, you can do soft tissues, you can do Achilles ruptures, peroneal tendon repairs. If there's an ankle fracture that rolls in, a DPM in Massachusetts currently can't do the ankle fracture.
Okay.
So where I did my training, there were no orthopedic residents. So what was really nice is you're never fighting for the knife with an ortho resident. So coming from the DPM program, we covered all the ortho cases below the knee. So we really got a strong, teaching foundation from ortho directly, in addition to the podiatry mentors that we had and podiatry attendings. And it was a really cordial relationship with ortho. There was no hostility. They love having us and we love learning from them. So it was really a nice training mix there.
What an outstanding learning opportunity.
Yeah, it was great.
So you finished up residency, you came back to Arizona, you just to divert and go on tangent, you got married.
Did.
And tell us about your family.
So I met my wife 2 weeks after moving to Arizona. So, came here single and, just ready to go to work. And you never know when things are going to happen. So things moved relatively quickly and got married a couple years later. And 9 months and a day after our wedding, we had our first son. So, got it going quickly. And we've had 3 boys within 3 years of each other. Now they're 6, 4, and 3. It's a blast. It's chaos, but it's a blast.
Oh, that's great.
Yeah.
At one point, my wife and I had 4 kids under the age of 10. Yeah. It was wild and crazy, but it also seems like it was yesterday. So don't blink, Jason.
Yeah, it does fly by.
It'll go by fast.
Yeah.
So with starting to practice, you're married, you're having children, you found time to give back to the profession and teach at the school. Tell us about your passion for teaching.
Sure. So initially, when I went into practice, I really just wanted to, become comfortable within practice. So, first couple years out of the gate, didn't go into teaching just yet. I just really wanted to, establish myself within the area, get comfortable, seeing patients in the office surgically. And then after a couple of years, I started to, feel more comfortable and gain confidence. And at that point, I wanted to try to open up, my practice and open up for teaching opportunities. Because I remember as a student, so when I was in med school in Arizona, so when I was a 3rd-year student, I scrubbed into 2 cases before I went on 4th-year externships, and that was it.
Wow.
And my first 4th-year externship, it was June of my 4th year, and I felt behind the ball. It was, get thrown into the OR, and I really didn't know what was going on. And, there were students from other schools who had been in the OR repeatedly and just felt comfortable in the OR, so I felt kind of like an outcast and an outlier. And within my practice, even though it's private practice, is a very strong surgical emphasis. So I'm in the OR quite a bit, 2 days a week. So once I became more established, I wanted to open up my clinic to this opportunity where students who would rotate, they would spend a good amount of time in the OR. And I've had students who would rotate, and even after a month in my office, they would tell me that in that 1 month, they were in the OR more than the rest of the year combined. And so I thought that was a unique experience where current students, 3rd-year students, can become more comfortable before going on these 4th-year externships, because the externships are stressful. It's a month-long interview, basically, to get a residency program.
The students tell me that a month with you is like a mini clerkship program.
That's great.
And in 2019, you were the attending of the year at the college. So congratulations.
Yeah, got the plaque on the wall.
It says a lot. Now, every year, students are looking for opportunities that will prepare them for clerkships. And as you know, they're all signing up to come and spend time with you. And we really, really appreciate all the time and energy you spend with them.
Yeah, absolutely happy to do it. Yeah.
All right, very good. So you had mentioned Adam Landsman, and I know Adam well. In fact, Adam, myself, Jason Hanft, and my son got a patent 2 years ago.
Wow.
Yep, it was for head trauma to help prevent concussions in soccer players or people in activities. And so you trained under Adam.
Absolutely.
And then I also noticed in your CV, you've got a patent pending from 2020. Can you tell us a little bit about that?
Sure. So where I practice, I see a lot of first-rate pathology. And so whether it's hallux valgus, hallux rigidus, I see just a ton of first-rate pathology. Now, it seems like there's a heavier emphasis on, either MBJ fusions or first TMT fusions, basically, in correction of that first ray. There's still, some of these joint sparing options that are out there, but there's been a huge push towards just the lapidus in general. Years ago, most commonly, I would say there's just different osteotomies that were performed. And with all these different osteotomies, they're a little less predictable as far as the long-term result, is just what I've tended to see. Some of them do exceptionally well. Some of them have recurrence. Some of them tilt into varus. Some of them develop arthritis at the joint later on. So a lot of these older type cases that come across in our office, really the solution at that point, if they're older, they have arthritis at the first MPJ, it's an MPJ fusion. So I do a ton of MPJ fusions. And also historically, there were a lot of implants placed at the first MPJ level. And so those have to be revised oftentimes. Oftentimes I'll see elevatas, the hallux just doesn't purchase the floor properly. There's different issues as to why these fail. And so getting myself more comfortable doing all these MPJ fusions, which is very routine within my office, I also have to revise a lot of these implants that have previously been placed. And so the revision of these implants is it's fairly complex, where we're taking these bone blocks from the calc, you got to move that bone block to the MPJ and then fuse across this larger autograft, basically. So we're in the process of patenting a type of material embedded within a plate to serve as that sort of scaffold, rather than jump into the calc and take this huge bone block, transfer that to the MPJ. So this would make more of like a one fell swoop for patients with different sizes based on the patient and with less pathology. The donor site morbidity involved taking these larger grafts on the calc. It's not completely benign. So if we can do something to, just lessen that donor site morbidity, then why not?
No, that makes sense. So tell me how this came around. I mean, just out of pure curiosity, you saw a need for it and you said, hey, let's make something happen, or did you join up with another company? How'd that play out?
Sure. So basically just doing enough of these calc graft harvests, which are just a pain in the butt, and being in the OR and being frustrated in doing them is what drove this sort of issue, and wondering if there was something that could be done that could make this easier on folks. And so in doing so, then combined up with a med device company, basically, to create this sort of product.
So indeed, necessity is the mother of invention.
Exactly. Yep.
Very good.
Yep.
So you applied for that patent in 2020.
Yep.
It's about a 3-year process minimum. So have you gotten any indications?
Not yet. Not yet.
Very good. Well, congratulations on that.
Appreciate it.
That's fascinating, because I know a lot of doctors that have, through treating patients and seeing challenges in the current available products that we use for patients, have invented products to help patients. So kudos to you on that. That's great. Let's talk about some research for a minute.
Sure.
Again, I start to wonder, Jason, when do you sleep, right? So you've got 10 publications over the last 10 years or so. You haven't even been in practice that long. Mm-hmm. Where do you get your passion for research?
So mainly it's just my passion for teaching, honestly, and trying to pair up with some of the current residents that I have and some of the current students that roll through my office. And, we look at some of the interesting cases that roll through the office, and some of these interesting cases, we'll do some research and see how much publication has been offered on some of these topics. And if there's some sort of, lacking research or just lacking, publications, then, we like to try to put out into the literature so other, practicing physicians don't have to go through the struggles of trying to, invent something, basically.
It's always interesting, because you're not quite sure who you're helping more, the patients or the doctors to help their patients.
Right. It's likely the doctors.
It is.
Yeah.
But, we tell our students that a lot. If you've got a good idea, do a literature review and then find that gap analysis. Find that gap in the literature where you can contribute.
Absolutely.
And that sounds exactly like what you're doing also. Kudos to you. That's great. That's fantastic. Let's talk about giving back to the profession a little bit. You've been very active with the American College of Foot and Ankle Surgeons, and you've been active for quite some time. Could you kind of share with our listeners that experience?
Sure. So I've always wanted to become involved with the American College of Foot and Ankle Surgery, and within that sort of process, so when you get into practice, basically you have to become board certified, and you have to be in practice for a certain number of years before you can become faculty. So as soon as I was eligible, I applied to become faculty. And even once you're faculty, it takes some time to kind of get your foot in the door to become involved with some of the, teaching offerings that they have. I specifically help quite a bit with the arthroscopy courses. I do a decent amount of arthroscopy within my practice. And so the scope course as a whole, I really love giving back, because when I was a resident, that was probably the most beneficial course that I completed as a resident. There's so much hands-on, time with a scope that you just don't have as a resident. Because when you're in the OR, you can't just mess around with the scope. I mean, these are live patients. You got to get your work done, tourniquets up, and every minute that tourniquet up is up, there are risks that are involved. So you don't have a ton of time to play. There are certain companies that do offer some of these hands-on arthroscopy labs. Then sometimes they'll even do it from a mobile standpoint now. But as a resident, it's just difficult to really get your hands wet doing these scopes. And so that scope course, basically for 2 days, whether you're a resident or a practicing physician, you're constantly using these instruments. And so after 2 days at one of these scope courses, I mean, students, residents, physicians, they leave so much more comfortable with the scope and that confidence. And so it's really nice kind of teaching and giving back from that standpoint within that particular course, because even from the morning of day 1 to the end of day 2, seeing the advancements of how much more comfortable people feel, it's incredible.
Oh, that's great. How many courses do you teach a year, you think?
Usually 2.
2?
Yeah.
Okay, very good. And do you go to Chicago for that?
Chicago. Yep. Don't really see Chicago. Go to the airport, hotel, scope course, hotel, scope course, and home. So
it's kind of how those meetings usually go.
Exactly.
No, that's great. Well, being part of the ACFAS and so active in the student recruitment effort we're teaming with ACFAS because one of their missions for the year is for their doctors to open up their practices to prospective students for shadowing. And we've already been beta testing that, of course, here in Arizona, and we do appreciate your willingness to let students come in and visit with you.
Absolutely.
Well, that's great. So I wanted to ask you a question about one of your pastimes. Last time I saw you, we were in the airport. Yeah. And we both flew back from Texas, and you were waiting for your archery equipment, and I was waiting for my shotgun because we were both competing. Yep. It's one of the things you do when you're not working is archery. Share with our audience your passions.
Sure. So I've always said to some of my residents and even students that I learn more from them than they learn from me. It's teaching residents, teaching students, it's a constant drive to continuously push our profession and to constantly gain ground and just basically avoid becoming a dinosaur within practice. So a few years ago, 4 years ago now, one of the students that I had for a month at my office, he was a big archer. And, whenever there was downtime, he would talk to me about archery all the time and would say how much I would love it. And I had never picked up a bow.
Was that Austin by chance?
It was Austin.
Okay, gotcha. Okay.
So Austin was really, putting this bug in my ear about archery repeatedly. And, after his month had finished, I ran into, another friend of mine, and he had just taken up archery. And so he put the other bug in my ear. And so at that point, I went and I bought a bow, basically. A month later is when COVID hit. And so, there was this little bit of lull where I had some time just because, it was early on. We never closed our office, so we were still, open, but we weren't as busy as we were beforehand. So a little bit of free time and basically just self-taught myself how to shoot the bow. And it's been incredible. It's such a release and the mental focus that it takes and the reproducibility, and it's really a rabbit hole when you dive into the science behind it. And so I really kind of, caught that bug and have gotten into it quite a bit, and I've flown around some other states and really gotten into it quite a bit.
So what's harder, the physical game or the mental game?
Mental.
By far, right?
By far. Absolutely. Yeah. Yep.
That's interesting you say that because I used to run a lot, climb a lot, and really that's just, you just got to put the effort in. Sure. And sporting clays or archery, it's kind of like golf. The harder you try, the worse you do.
It can absolutely go that way.
Absolutely.
Sure. Yeah.
Well, that's neat. So what are your aspirations in archery?
So, with archery, growing up in a city, I grew up, I was, into fishing. I was into, camping. I was always into hiking and just the outdoors in general. Moving to Arizona, so being in sort of a landlocked state, I got into fly fishing. So, I had never gone fly fishing before and started doing some of that and some of the smaller streams and whatnot. And, it was okay. And it was a good, mental release from practice and family and just kind of focusing on something other than patients constantly. But there was just still, it seemed like there was something missing. And so then I got into the archery thing. And with archery, really sort of combining, archery with the outdoors and camping and hiking and all this sort of stuff, I actually got into like archery elk hunting as, I don't want to be controversial on a podcast, but it's still something that I'm learning and pursuing. And that's kind of what I've become a bit passionate about over recent years.
That's great. That's not controversial. That's awesome.
Okay. Yeah.
Great work. Yeah. Well, very good. Well, good luck with that going forward. I'd like to even go out with you sometime and do that.
Yeah, absolutely.
That'd be a lot of fun.
Sure.
All right. So there you go. So there's work-life balance, it's not all work and no fun, right?
That's right. Absolutely.
All right,
Yeah.
sounds good. So something we talked about this afternoon earlier, you went into private practice, but then you also recently sold your practice out to a private equity firm.
Correct.
Can we talk about that for a little bit?
Absolutely. We'll dive in. Yeah.
Let's dive in. So when were you first introduced to this concept and got the ball rolling?
So 3 years ago was the first time I was introduced to this sort of concept where out of the blue, we were approached by a private equity group, and they basically just kind of gave us an offer for our practice and the details behind it, and where you'd be an employee afterwards for a certain period of time, and it just wasn't the right sort of opportunity. So we passed on that basically and just kind of kept grinding, and we had no real intention of like selling our practice and becoming part of a private equity group. But later on, a couple of years later, we were approached by a different group, and that group, it seemed more promising, but it just kind of fizzled at the end. And very shortly thereafter, we were approached by a third group, and this third group is who bought our practice and we're currently employees of. But with this group, basically, and it takes a long time to get to the finish line. It was a 9 to 12 month process, but everything seemed to work out where it seemed like the ideas behind it and trying to take a smaller group, we were a 4-physician practice at the time, and basically join forces and, have some leverage from an insurance company standpoint. And it all kind of worked out, and we ended up closing the deal a year ago now, a little over a year. So it's been a full year.
Wow. So, I see a lot of online forum discussion on private equity and docs
Sure.
becoming employees. Do you mind just sharing maybe for people that are interested in being in a position like you are eventually, what were the pros and cons? What were you weighing out in that process?
So we've heard, a lot of good and bad basically with joining private equity. And, some of the pros that I was looking at is my day-to-day wouldn't change. So I'm still going to practice at the same, private practice type setting. It's not as if I'm now, becoming strictly a hospital employee or something just totally different than my usual day-to-day. So my day-to-day doesn't really change. They did not come in and micromanage our day-to-day. It's a relatively small group, and they're based, out of state. So, they're not in our face every day. They didn't send someone in and change the entirety of our practice. Basically, they were happy with how our production was at the practice. So, they wanted to absorb our practice and just allow us to continue as we had been doing for a decade at the time. So the day-to-day really, didn't change dramatically, weren't micromanaged, and we aren't micromanaged. On the flip side, one of the worries is that you sell out to some sort of group, and now you have a boss breathing down your neck. They come in, they can change the entirety of your practice. They can change your EMR system. They can, bring in their own staff and billing and all of this. None of that has happened. So all of our staff we've retained, even our personal biller, we've retained her. Like it's been great.
If you don't mind asking me, the group that bought you is?
Podiatric Growth Partners.
Podiatry Growth Partners. And then when you sell your practice, do you end up getting an equity stake within that group?
Correct. Exactly. So basically the way these offers kind of work, if anyone listening ends up in one of these positions, so there's an offering, and within that offering, a certain portion of that is cash and a certain portion of that is equity within that group. And so, that equity within the group, you still have, some sort of incentive to continuously try to grow your practice. And within that equity, lots of these groups are sort of popping up, and their eventual goal is to try to sell to another group. So, whenever that happens, I still won't know if this was the best thing to do. It's, if everything continues to go the same, sure, that's awesome. If someone else buys it and then they come in and change everything about our practice, it's a risk that we took. It's, there's definitely more predictability if we did not sell, but overall, we've been fairly happy.
Understandable. Well, congratulations. That's a big decision.
It was a huge decision. Yeah.
Absolutely. Well, it's neat that you were able to maintain your staff and maintain your billing, and continuity is so important. Patients even enjoy it.
Absolutely. Yeah.
So that's great.
And patients don't know any different. So, and that's our goal and that was one of our, points of emphasis when you go through all these meetings with one of these groups that come in, we wanted the feel of almost like a little mom and pop type podiatry or foot and ankle surgery type setting. And so, when a patient calls, schedules their appointment, when they see the doctor, that experience, we wanted to maintain the same experience thereafter. And so it's not as if patients now come in and feel any different. It is all the same. And so that's what we're happy with.
That makes sense. So let me pivot here a little bit. So you've got an eye for innovation, and you've seen it's been a decade, right, since you've been out?
It has, yeah.
What do you see going forward? Changes in the profession from a surgical perspective to improve patient outcomes? Anything that just kind of you say, hey, that's a really neat thing. What's going on out there?
Yeah, so it seems like there's a huge push towards just the reproducibility and the predictability of, surgical outcomes of patients. And so a lot of companies, they're trying to come out with like jigs and devices to assist with correction of certain deformities. And so that allows for more potential predictability. But another area where I've seen a huge change is a lot of these companies are now coming out and they do direct to patient marketing, basically. So, it used to be patients would go to their doctor, and then their doctor might give them a referral to a DPM. And so that kind of changed, 10, 15, 20 years ago, where based on insurance contracts, some insurance contracts still require a referral, but a lot of them do not. So a lot of patients go online and they do their own research, and then they find their own doctor from a specialist standpoint. And now a lot of these companies, they're coming out and they're doing direct to patient marketing. And so they're driving patients to their, company website. And on that company website, there will be a list of physicians. And so they're trying to basically drive patients to certain doctors where these companies will now know that that doctor will use that product to correct a certain deformity. And so that's been a huge change that did not exist when I first went into practice, and that does exist now. So I see that continuing to go forward. So that's been a huge change.
Makes sense. Well, how about changes in fixation techniques? Is anything on the horizon besides the jigs and reproducibility? Anything just groundbreaking coming up?
So I haven't seen anything groundbreaking. I mean, people say a screw is a screw and a plate is a plate. And there's some accuracy to that. It's from a fixation standpoint, I haven't seen any dramatic changes, honestly.
Okay, very good. So how about personally, what do you 10 years from now, what do you plan on doing? What are you going to be doing?
Sure. I'll still be doing this. It's, I enjoy patient care. I enjoy teaching. So I'll always still be involved with the school or residency program. It's, it sort of breaks up the monotony of the day-to-day, just constantly treating patients and being in the OR. I like you mentioned, I like having a lot of stuff on my plate, basically. And so that I kind of thrive with that sort of atmosphere. And so I don't see myself doing anything different a decade from now. I see myself in the same sort of
You're
spot.
probably going to be going up to a lot of soccer games, baseball games, basketball games.
Yeah, the weekends will be just slammed with that sort of stuff.
Absolutely.
Sure. Absolutely.
So I wanted to thank you for participating or taking that Big 5 personality test.
Oh yeah, that's fun.
It looks at 5 different areas of personality, and we've been doing this on a lot of these podcast episodes, and it's amazing the similarities we see with leaders in the profession. So with your permission, I was going to share a couple things about your results. So you were the highest I've ever seen, I might add, in conscientiousness, and conscientiousness is a combination of industriousness and orderliness. Is that any surprise to you?
It's not. Yeah, it's even when I was in med school and, when I'm studying, I could not study if like my room wasn't put together perfectly. So it's just, maybe it's a little bit of OCD, but I need everything in order basically for me to focus on a task at hand.
Makes sense. I think a lot of people are more productive if everything's in order.
Yep. So
part of that industriousness, this is interesting. I've been doing some research on this. If you have a high industriousness number, like you do, it's the number one predictor of success over and above even intelligence or IQ. It's fascinating.
Wow.
So were you industrious when you were a kid?
Apparently, yeah.
No, I just wonder if anything just stood out in your mind.
Nothing in particular, but I've always been just very driven, basically. It's I like a challenge. I don't feel accomplished when something is easy. So, I like difficult tasks, and I'm just the type of person, if I set my mind to something, I won't stop until it's done. It's just how I've always been. And, I grew up, I was very competitive with sports. And so I, played baseball, basketball, football. That was, my love before college, basically. And so, I took that very serious. And then, my drive changed and, went into this sort of field and, even parenting at home and being a husband. I take everything, I want to take it to the next level and do it to the absolute utmost that I could possibly do.
Makes sense. Your next highest was extroversion, which is a combination of enthusiasm and assertiveness.
So with that, it's kind of interesting because, being in this sort of profession and you're dealing with patients constantly, and, my typical day, I usually see 35 to 40 patients. If I'm in my office, if I'm in the OR, I generally do like 4 to 7 cases a week. And so when I'm in the office, those days where I'm seeing 35 to 40 patients, and students who rotate with me will see this, and I tell them every single time before I knock on a door and go into the patient's room, even if it's an established patient, a new patient, you got to just flip a switch and bring some enthusiasm to the table. And so I try to have a, really strong bedside personality and be, very empathetic with patients and friendly. I try to educate patients on, their condition, the options, but basically just bring enthusiasm to the table. And so, every day I do enjoy that. When I leave work, it's almost like I'd rather not be around people. So I was kind of surprised with that answer, but
Okay.
it's, I do love being around people throughout the day. I think if I was in a different sort of field where, if I sat at a desk all day in front of a computer, when work ended, I'd want to be out around people. But I do get so much of that every single day constantly that when I can finally step back at the end of the day, it's almost like I just want to, be at home with the family. And I don't see myself as super extroverted, but I guess I am with that.
Yeah, it only takes 10 or 15 minutes to take that test, and everybody always says it's uncanny at how accurate it appears to be.
Yep.
Yeah. So anyways, thanks for doing that.
Absolutely.
I think it adds a lot to the show and a little segment on here.
Yeah.
So Jason, what would you tell, or what do you tell prospective students about the field of podiatric medicine?
Sure. So what's nice about this field is that you can take it in so many different directions. So, you can go into wound care, you can go into trauma, you can become like a hospitalist-based podiatrist, you can become a private practice where you have a huge, heavy surgical emphasis, you could have no surgical emphasis, you could go to nursing homes and chip and clip, you could join an ortho group, you could join a multidisciplinary group. There's so many different options of what you could do within one specific field. And so there's just that, vast array of what could be, I think is what's super appealing within our profession. And so, that's something that I tell prospective students, current students, residents, when I ask, what do you think you want to do? And, a lot of residents, even third-year residents, aren't sure yet what they want to do and where they want to practice and what type of practice. And it's just something that, some people have one job forever and most people don't. So it is a type of field where you can hop around a little bit and go into different sort of disciplines.
Very good. And comment on the shadowing experience.
Sure. So going back to when I first shadowed Dr. Taubman, that created such a strong foundation for me. And so that really kind of is a place of emphasis and kind of close to my heart, basically, where I can take myself back when I was in a position as a student where I had no idea what I wanted to do someday. I just knew I was pre-med, taking all these, prereqs. So when I have when I have students that come in and they're not sure what they want to go into, I sit down with them. And when the day ends, I give them as much time as they need and fire as many questions at me as you want. I'm not going anywhere until you have all your questions answered, basically. And then I invite them to follow up on other days. And it used to be easier to allow them to come into the OR. Now that's a little bit different ever since COVID, so they can't really see things in the OR, but I just try to give them, a decent understanding of what we can do in the OR. And, I really take that seriously when I can potentially influence, someone's life decisions on a career.
Well, your enthusiasm is contagious, and I know the students that have spent time with you certainly appreciate your candidness and You certainly are a mentor. And
Appreciate it.
on behalf of the faculty and Arizona College, we're sure glad you're part of the faculty, and we appreciate all you do.
And I'm very happy to be part of the faculty.
Well, that's great. Well, Jason, thank you for your time and your energy and your enthusiasm and your industriousness.
Absolutely.
And thank you for joining me on Dean's Chat. We strive to get leaders in the profession, and one of my goals is to get younger practitioners like yourself that are very successful to really pave the way for this next generation of students coming through. So thank you very much.
Absolutely. Pleasure.
And Jason, we've got one of these Dean's Chat cups for you.
Beautiful.
I don't know if you drink coffee.
I'm pretty serious about my coffee.
All right, well, then this will make it more serious.
Yeah.
So we've got a Dean's Chat cup for you. And to all of our listeners out there, thank you so much for listening. If you're on Spotify or Apple Podcast or Google Podcast, please give us a 5-star rating. If you're on YouTube, by all means, please become a subscriber. And until next week, cheers, everyone.